Listen closely. Most strokes don't strike without warning. They whisper first. And if you're over 50, ignoring those whispers is the most dangerous mistake you can make. Your body is currently giving you clues, small, seemingly harmless signs that could save your life if you know how to read them. Today, we decode those silent signals. But as a nurse who's spent decades in the ER, I can tell you those harmless symptoms are often the body's final whispers before a scream. Today, we're uncovering the silent stroke warning signs doctors might miss, but you cannot afford to ignore. We'll also cover exactly what to do before, during, and after a stroke to give you or your loved ones the best chance at a full recovery. Welcome to Adult Health Hub. We break down complex health topics into simple language to keep you informed and protected. I've seen the charts, but more importantly, I've seen the people. I've sat with patients who said, "I felt something, but I didn't think it was this." Doctors look at data, nurses look at life. Today, I'm sharing that frontline knowledge because early detection is the only true prevention. Let's start with the basics. A stroke is essentially a brain attack. It happens when blood flow to part of the brain is cut off. Without blood, brain cells are starved of oxygen and begin to die within minutes. This is why every single second counts. Most strokes are ischemic, meaning a clot blocks the vessel. It's like a kink in a garden hose, stopping the flow to the garden. Then there are hemorrhagic strokes, where a vessel actually bursts. This causes bleeding that damages the surrounding brain tissue. The problem with silent strokes is that they don't always cause paralysis or slurred speech right away. Sometimes it's much more subtle. One symptom we'll cover later is so common it's almost always mistaken for ordinary aging. Make sure you stay for that one. Symptom number 1. Sudden dizziness or loss of balance. In the clinic, patients often say they just felt a bit off. They blame it on dehydration, stress, or a late night. But if that dizziness comes on suddenly and without cause, that's a red flag. If that dizziness is paired with even a tiny bit of weakness or blurred vision, don't wait for it to pass. It's your brain signaling for help. Symptom 2. Temporary numbness. This is a big one. It might just be a pins and needles feeling in one arm or leg. People often think they just slept on it wrong. But temporary numbness can be a TIA, a mini stroke that serves as a massive warning. Even if the feeling comes back in 5 minutes, you need to be seen. A TIA often precedes a major disabling stroke by just a few days. Symptom 3. Sudden blurred vision or loss of sight in one eye. This is often described as a curtain coming down. It isn't just needing new glasses. If you suddenly lose your peripheral vision or things get hazy in one eye, your brain's visual center is struggling. I've seen patients wait days to see if it clears up. By then, the damage is often permanent. Vision changes are emergency changes. Symptom 4. Sudden confusion or trouble speaking. This might manifest as forgetting a very common word or names of loved ones. It's not senior moments. If you can't find the word for phone or water, or if you're struggling to understand what people are saying, that's serious. In the hospital, we call this aphasia. It's a direct sign that the speech centers of your brain aren't getting what they need. Symptom 5. A sudden severe headache unlike any you've had before. Doctors often call it the thunderclap headache. If a headache hits you like a bolt of lightning and is the worst pain you've ever felt, it could be a sign of a hemorrhagic stroke. Don't just take an aspirin and go to sleep. That's the worst thing you can do if there's internal bleeding. You need a scan immediately. Symptom 6. Facial drooping. This is often more obvious to others than to yourself. One side of your face might feel heavy or numb. Look in the mirror and smile. Is it uneven? Does one corner of your mouth stay down? This is a classic, undeniable sign of stroke. Symptom 7. Sudden weakness, especially on one side of the body. You might suddenly drop something or feel your leg give way. Stroke almost always affects just one side of the brain, which means it affects the opposite side of the body. Weakness on just one side is a dead giveaway. Symptom 8. Sudden, overwhelming fatigue. This is the one I mentioned earlier, the one everyone ignores as just being tired. If you go from feeling fine to being so exhausted you can barely lift your head, and it's paired with any other tiny symptom, that's not age, that's a warning. In the ER, we use the word FAST to identify stroke symptoms instantly. It's a tool every adult over 50 should have memorized. I've taught this to hundreds of families. It's simple, it's effective, and it saves lives when every minute counts. F is for face drooping. Ask the person to smile. Does one side of the face sag or feel numb? If so, act. A is for arm weakness. Ask them to raise both arms. Does one arm drift downward? Is there a lack of coordination? S is for speech difficulty. Is their speech slurred? Can they repeat a simple sentence like "the sky is blue"? If it's garbled, it's a stroke. T is for time. If you see any of these signs, call emergency services immediately. Don't call a friend, don't call a doctor, call 911. Now for the good news, 80% of strokes are preventable. You have more power than you think to keep your brain healthy. I've seen patients turn their health around in their 60s and 70s. It's never too late to start protecting your future. The number one risk factor is high blood pressure. It's the silent killer because you can't feel it damaging your arteries. Get a home monitor, keep a log. Managing your blood pressure alone significantly lowers your stroke risk by more than half. Diabetes also damages blood vessels over time. Keeping your blood sugar in check is vital for brain health. If you smoke, it's time to stop. Smoking doubles your risk of stroke by thickening your blood and increasing plaque buildup. Focus on a Mediterranean-style diet. Lots of greens, healthy fats like olive oil, and lean proteins. Your brain runs on what you eat. You don't need to run a marathon. Just 30 minutes of brisk walking 5 days a week makes a world of difference. Never underestimate sleep and stress management. High stress and poor sleep lead to high blood pressure. Take time to rest. If a stroke is happening, do not drive yourself to the hospital. You could lose consciousness behind the wheel. Emergency responders can start treatment the moment they arrive. That extra 20 minutes in the ambulance can save millions of brain cells. Note the exact time symptoms started. There are life-saving, clot-busting drugs that only work if given within a specific window of time. Recovery takes time, and I won't lie to you, it can be hard work. But I've seen incredible progress in patients who stayed committed. Physical and speech therapy are your best friends. The brain has an amazing ability to rewire itself through a process called neuroplasticity. Small wins matter. Being able to hold a fork again or saying a full sentence. Those are massive milestones. There is always hope. Your body often whispers before it screams. Listen to those whispers. It could save your life or the life of someone you love. Subscribe to Adult Health Hub for more simple health education. Let's look out for each other. Stay safe and stay informed.